My name is Olivia, and I beat my carcinoma with the Phase 1 diet. Welcome to Know the Cause with Doug Kaufman.
Well, thank you, Olivia. Olivia is going to be back in the opening of today's show because she has a health problem that we all need to talk about. Early cancer cells. What prevents them from becoming late cancer cells and full-bloom cancer cells, okay? I believe it's diet. But wait till you see what Olivia was told, and then we'll expound on that, okay? Later in the show, Dr. John Trowbridge sat down with me, several months ago, and he talked about when his patients come in, they all want a test. And he says, why? Because I saw it on TV, I want a pill or I want a test. So we'll talk a little bit about that. Susie is going to talk about toxins in tampons, and then toward the end of the show, we have Boney, our skeleton here, who I'm going to do a little back surgery on. Do the rules change when someone has surgery? Will diet still work? Will supplements work? All that and more on today's Know the Cause. Based on the observation that we have quite a day, a lot of people to get in here today, let's start with a story of a young girl who went to the doctor like many young girls do. She heard what many young girls do. Watch this with Olivia.
My name is Olivia. I had precancer cells, dysplasia, and then I also had signs of carcinoma on my cervix. And when they found that, they also found a yeast overgrowth. And they told me that I had HPV virus and that I was supposed to be getting surgery to have it either removed or a total hysterectomy. But they were going to do further testing. So they did more testing. There's still nothing that they could do. And they said that we're just going to have to remove it. There's nothing I can change with my diet.
Did she just say what I think she said? There's nothing you can do with your diet. Folks, I speak to large numbers of people. I have in the past month 3 lectures. Many people with cancer come up to me and say, my doctor said there's nothing, diet doesn't play a role, don't change your diet. How sad that is. I think every doctor mandatorily should be able to teach his patient about the role of diet, right? So let's go to the American Cancer Association's diet. This is a long way of saying they recommend 5 or more servings of fruit and vegetables a day, which I agree with. Choosing whole grains over processed, which I don't agree with. I don't know if whole grains are better than refined foods because I won't eat either of them. And limiting red meats and animal fats. However, they do say animal studies have shown some positive results regarding mushrooms. And scientists say, caution, broccoli. Unbelievable, folks. Eat mushrooms, don't eat broccoli, and eat whole grains. Oh, we got problems. We got problems right at the surface. Here's why. Corn is a whole grain, just like wheat's a whole grain if the bran, germ, and endosperm are still left intact. Fusarium is a mold that are ubiquitous in corn plants. It's going to have a mold. Mold makes a poison called aflatoxin B1, and in 1988, this agency, International Agency for Research on Cancer, placed that mold's poison on the list of human carcinogens. So should cancer patients eat corn as recommended by the American Cancer Society? Your doctor is telling you, look, eat peanuts. They're very often impregnated with mold. There are so many cancers linked to red meat that doctors really believe it's the cow's fault, okay? Red meat, cows cause cancer? Folks, it's what we're giving to the cow. Cattle are raised in America with growth in mind. That's it. Antibiotics themselves are growth promoters, and hormones like zeranol or zenol are fed to cattle. Fusarium's the mold. This is the mycotoxin. So fusarium makes both aflatoxin B1, a carcinogen, and it makes zeranol. It is found to be contaminated in fungus-infected crops. Zeranol is approved for use as a growth promoter here in the U.S. Man, wow. Not in other countries, but here in the U.S. It's almost, folks, as if we're some kind of scientific experiment for food companies. I don't know, Americans will do it. Let's put it in there. Why are we putting this growth promoter, this hormone, in meat. It's estrogenic. Aren't these cancers now all estrogen positive cancers? How are we getting all this estrogen? Zeranol increases cancer cell proliferation in already existing breast cancer. Overall evidence points to zeranol being a risk factor and promoter for cancer. However, one study said it's really insignificant. This doesn't cause any health problems at all. Should cancer patients avoid meat or growth promoters that have been added to the meat? I got to tell you, folks, I don't follow the American cancer diet. If I had cancer, I wouldn't follow it. Now, having said that, always check with your doctor. I don't know your cancer. I don't know your health problem. But in this little girl's case, I think we're going to find out that by following Kaufman's diet, she did quite well. Watch this.
And then I saw Doug Kaufman's TV show, and I did the phase 1 diet, and I alkalized my body, cut out sugar, cut out dairy, gluten, soy, and I came back 6 months later, and the cancer cells are gone, completely gone. I don't have any more yeast problems. I'm not tired. I mean, it's just when you heal your body, you don't just heal one thing, you heal everything. And I mean, I'm going to stick to this diet. I just quit my job. I'm actually going to school for nutrition.
You know, I'm equally excited for both Olivia going into clinical nutrition and all of the patients she will see. Can you imagine the advantage they'll have? Don't go away, because when we get back, we've got That's My Take. We've got Dr. John Trowbridge. We've got Susie talking about toxic tampons. And we've got a feeble attempt by your host at doing back surgery on someone. Do the rules change after surgery? Don't go away. So it's your friend's 50th birthday, and you want to throw a party for him or her, or it's your little child, 4 years old, it's a birthday party. You feel so good following this diet, or your friend feels so good following this diet, you think, finger foods, I want to have snacks, what do I give them? Welcome to Denny, Dining with Denny. This was a great idea.
Well, yeah, like you say, and often people are just accustomed to eating a sandwich, something they can pick up and eat. And so this is just a way to do it without bread. You know, we have some phase 1 breads that we've come up with, but if you don't want to go to the trouble of making bread or
eating it.
Yeah, then this is a good alternative.
You met me at my own house the other day with one of these. Oh. It is so good. What's included there?
Cream cheese and smoked salmon with a little bit of diced red onion, just in cucumbers. It's basically everything you'd have in a bagel, but without the bagel. Oh. And so we just put it between a couple of cucumbers.
Just roll up turkey roll.
This is sliced turkey with a little bit of kale. You could put anything you want inside it, just kind of like an inside-out salad. I've got some cucumbers, some kale, tomatoes, shredded carrots. And just roll them up.
I always say, standing here watching Denny, it's so simple. Now, could I do this? Absolutely not.
Yes, you could.
The tray.
Yes, you could.
Look at it. The presentation is so exquisite. The food, bok choy.
This is bok choy with some chicken salad. This is like a bacon, lettuce, and tomato sandwich without the bread. It's basically bacon, tomato, and avocado mixed together, with a little bit of our homemade coconut mayonnaise inside the romaine lettuce leaves. And this is our lettuce wraps that we did with the Asian chicken inside. There you go.
The presentation is wonderful. You'll be happy after the party. You'll feel so good. Thank you, Denny, for coming in. This is a wonderfully healthy way to party. Mayo Clinic recently published nerve damage after hip surgery may be due to inflammation. So in a few minutes, we're going to go over and I'm going to do a little what would be called major surgery on the back of our skeleton here. Her name is Boney. And I'm going to talk a little bit about that. There are post-surgical complications that you folks need to know about. Many of you have had knee, hip, back surgery, etc., and have never been the same since. This article, I think, addresses that. A recent Mayo Clinic Proceedings article links some nerve damage after hip surgery to an inflammatory neuropathy. Do you guys think, like I do, that the word inflammation is being just used and abused like crazy? Do you remember the cover of Time magazine 10 years ago? Alzheimer's, cancer, all these diseases, are they linked with inflammation? Because after the patient dies, they look inside their body during autopsy and they see, wow, it's all swollen. That inflammation must have killed them. Here's the take-home message, folks. The C-reactive protein, you go into a doctor and he suspects inflammation going on in your body, he'll draw some blood and do a CRP, C-reactive protein test. And he will say, yep, sure enough, I was right. Inflammation is your problem. Your question, of course, even following surgery, you now have neuropathy. Your question is, why do I have inflammation? His answer is, we don't know, but here's some anti-inflammatories. My answer would be, wait a minute, what makes bread rise? Could that same yeast somehow get in the tissues of our body and press, as the tissue grows, press on the nerves or occlude blood flow or really injure us? You bet it can, folks. That's what yeast does. It makes things rise, bread knowingly, and sometimes we humans. And by the way, yeast increases the CRP test also. I bet your doctor doesn't know that. Think, folks, think long and hard before the surgery. Are there ways to get around it? And then after the surgery, think fungus.
I've had been at MD since I was 12. I'm going to be 51 and they still don't know what kind that I have. There's no diagnosis, there's no medication. Pretty much I'm on my own, whatever I do. And Doug has hit the mark with this one. Last March I had started on Doug Kaufman's diet. Within 2 weeks, my craving for bread fell away. Right behind that, the weight came down. Like I said, I've lost 60 pounds. And no more swollen ankles, no more swollen legs. I could stand up straight. I'm walking 6-7 miles a day now. The weight off really makes me very mobile. Change your diet. I mean, you do need to be mobile and exercise, but everyone thinks they can do it with just exercise. I couldn't exercise. I couldn't hardly walk. Now I have no cane. I walk on my own. I can carry my granddaughter around. Strictly stay to the diet and just see what happens.
Hi, I'm Susie Cohen, America's Pharmacist. Don't you think we as women deserve to know exactly what's going into our bodies? Unfortunately, the makers of tampons and sanitary pads don't think so. They don't have to fully disclose the ingredients because personal hygiene items are categorized as medical devices. Yeah, really. I was stunned when I learned that the most popular tampons and pads are bleached using chlorine dioxide. And while the process is technically chlorine-free, it does produce dioxin as a byproduct. And that's not it. Conventional tampons often contain pesticides. We're all so afraid of eating pesticides in our food, yet we expose our most delicate parts to this stuff, and we take up the toxins through the blood vessels from our nether regions. Basically, what I'm saying is that some tampons and sanitary napkins are a chemical soup of artificial colors, fragrances, polyester, adhesives, polyethylene, propylene glycol, and contaminants, some of which are linked to hormone disruption. Now, if you use these personal items, consider cleaner, chemical-free brands like Nature Care. It's sold at health food stores nationwide.
You know, I'm fascinated by that. A chemical soup? Just be careful out there, folks. It's a crazy, crazy world. Dr. John Trowbridge, a friend of mine, a contributor to Know the Cause, talks about biofilms, gluten tests, and a whole bunch of other things. I sat down with him a short time ago. Watch this. You have gluten intolerance. You have gluten sensitivity. Joining me right now was one of my mentors. Dr. John Trowbridge wrote a book 30 years ago, just about. And the book just sold and sold and sold, thank God. It was called The Yeast Syndrome. You see, The Connection was out before, and The Missing Diagnosis by Dr. Trust was out before. But those books talked about yeast as though it's a vaginal tract that can go awry. This doctor was talking about yeast in the eyeball and in the head and in the skin and so forth. So you were one of my heroes. I had just started to work in a hospital. Back when you and I were younger, I remember this. We had, at a time, now I'm going back to the 70s, mid-70s, gluten problems arose back then. And all of a sudden they were gone. It was like a fad, and then they were gone. Now we have gluten enteropathies. We have gluten diseases now. Everybody's being diagnosed with gluten disease. Can I get your take on that?
Sure. How much money do you want to spend?
None.
Because pretty basically, I get patients ask me all the time, can I get this test, can I get this? And I go, what do you want me to do about that? Well, what are you interested in? Well, I want to see if I have that as a problem. I go, okay, so you have it as a problem. Now, what we want to do is this. Because what they want is go on the test. I'll give you a great example. When we test for yeast, I test every patient who comes in who has any suspicion at all that they got yeast. I do the yeast antibody test that Ed Winger developed.
Okay, good.
And
is
they
Ed
go,
still around?
It's still around.
I'll be
It's
darned.
still available. He sold it to another lab. It's still available. They don't do it as well as he did, but I get the test once. And then like yesterday, I had a patient say, okay, can we test that again? And I go, why? She goes, well, I want to see how I'm doing. I go, you're doing a lot better. She goes, but can we do the test? And I go, how much money do you want to spend? Because we can do the test all the time. If it's up, it doesn't matter because you're still getting better, and that means you're recovering the ability to fight the yeast. If it's still down, it doesn't mean anything because you're getting better. So why do it? And there's a lot of tests that fall like that. Now, we have several different tests for gluten sensitivity. We have the anti-gliadin antibodies. We have those special tests. We've got also inhaling tests for this and that and the other. The question is, what do you want as a result, not as an answer? Okay, because I'll just write all your answers for you down right now, and I'll be right 90% of the time. But I don't need a test to do that. What I want as a result is you to feel remarkably better so you never think of this again.
And you know what, Dr. Trowbridge? Okay, now, hi, and you've been on the gluten-free diet for what, a month now? Here's the 4
they
words.
come in having been on it for years.
Yeah. How do you feel? I feel great. Why do you want the test done again? It's obviously working. And
but
so,
I get people who come in and they've been on this for years and they're not better. And it's because that's only a piece of the puzzle.
Thank you.
Tables have 4 legs for a very good reason. Don't fix 3 of them. You still can't use the table.
Yep.
You got to fix all the legs.
This is interesting because new tests are coming on the market.
All the time.
That's why these things are going crazy. Here's the bottom line, folks. Do you think you're gluten sensitive? Stop eating wheat.
There's an idea right there. Okay.
You know how much that
Let me write
cost
that
me?
down. That's good. I'm going to remember that.
Guess what that cost me? 0.
Nothing.
We're so hungry for tests. What did we learn about the PSA? There's a book coming out soon, I promise you, that is going to tell the truth about what the PSA was. All these tests were so hungry to get tested. How do you feel? I feel great. Now, while I have you here,
Sure.
brand new buzzword last year or two in science, biofilm. I don't know
Biofilm.
if it's 1 word or 2 words, but what is it?
Oh, it's very simple. Don't brush your teeth tonight. Tomorrow morning you'll wake up, you'll feel the biofilm. Now it's there anyway, it's just it's not overgrowing because we keep it in check by good mouth hygiene and so on. Everywhere you have a wet surface, you have a biofilm.
Oh.
Everywhere you have a wet surface, you have a biofilm. Is that table sterile? Well, probably pretty much so. You can swab it. You may find a few bacteria. They all grow in biofilms. Oh, not just bacteria, but funguses, parasites, viruses. They're all a happy community. And the biofilm community separates the functions. You guys do this better, you do that for all of us. We do this better, we'll do that for all of you. And that's where you want to keep a happy biofilm, not a sad one. That will get you sick.
Well, thank you for saying there are fungal biofilms. I remember when this word first came out, the B word was everywhere. Does science understand fungus at all? Everything's bacterial.
No, it's all bacterial. and the fungus you might get, in case you're one of those who gets vaginitis, when we give you antibiotics, we'll give you a little something for that, a little cream for that.
Exactly. Incidental, in other words.
Exactly.
Has this frustrated you as a doctor who wrote a best-selling book on this? Does it frustrate you when your peers, who have no idea who you were, because that was 30 years ago, you had dark hair, wrote this book? Does it frustrate you eating lunch at the hospital with them?
I don't eat lunch at the hospital. I resigned from that 20-some years ago.
Because it did frustrate you.
Exactly. No, I'll tell you quite honestly, Doug, it's very simple. I used to think that you could really change the world. No, you change doctors one at a time. And that's it. You get one here, one there, and you hope your patients will convince one here, one there. It's hard to do.
You give a doctor a fish, he eats for a day. Teach a doctor to fish, he understands fungus.
No, teach a doctor to fish, he goes back and eats the fish, and that's it. He's done. He doesn't need to learn anything. He's a doctor.
Dr. John Trowbridge, my good friend for so many years, thank you for the friendship. Thank you for enlightening my audience.
Thank you.
Don't go away, friends. More of Know the Cause right around the corner.
Just before Christmas, this past Christmas, my husband went to the doctor. He had been ill for a few weeks, and he went and he found out something that was totally different than what he went for. They came in and told him his PSA was 21.4. They were very concerned and wanted to do a biopsy. We weren't going that direction, so we went home and started on the phase 1 diet, along with olive leaf and some omegas and vitamin C, and 30 days later went back and had another PSA test. They called him the next day with the results. Very exciting. His PSA was 2.1. The nurse told my husband, "I've never seen anything like this. What are you doing?" And he said, "We're praying and doing an antifungal diet." And she said, "Well, keep doing it, and we don't need to see you again for 3 months. Do the phase 1 diet, or at least the phase 2. If the phase 1's a little too strict for you, at least do the phase 2. Oh yes, he's lost his belly.
Okay, now this is surgery. And as we talked about earlier, friends, sometimes people go off of certain foods and they don't need the surgery. That's what happened to Olivia as we opened today's show. When should Bonnie, we love her here, when should Bonnie have surgery? Let's talk a little bit about what I hear all the time, because this is it. 7 years ago, Doug, says Jane, I had back surgery. I've tried your phase 1 diet for 2 months and feel no difference. It worked for my friend at church, but not for me. Surgery can sometimes change all the rules. I don't know. I think it's a good thing. First of all, I worked for a couple surgeons, and they could put people out of pain amazingly, but complications exist. So this might be the fourth thing I do. I might look at flexing. I might look at stretching. I might get a physical therapist. I might change my diet, just like Olivia did, okay? Look at this one. I thought this was fascinating because I get asked this so often also. My brother and I were both diagnosed with prostate disease about the same time. I've had a complete prostatectomy. My doctor refuses antifungal medications. I'm on your phase 1 diet, but I see no difference in my incontinence and my impotency. Help, says Jerome. You know, this happened to a fellow named Marvin, and we actually recorded it. Watch his testimonial.
The doctor wanted to give me several different shots or have an operation, take these seeds, and I said, no, I'm not going to do anything. So I got on Doug's diet, and I went back in 6 months. And he couldn't find anything. So my brother, he was diagnosed the same as I was. He had an operation, and he's having all kinds of problems now.
In the operating rooms in Vietnam, we used cloth hats. A pharmacist who sold me this, what they call a scarf, told me that the hip doctors now wear scarves in the operating room like that. So I guess I'm a hip doctor in the operating room. Now, Marvin just said, so I'm doing great. I followed the phase 1 diet. I feel great. My brother's having all these complications. Sometimes health problems ensue following surgery and the rules change. What are some of the complications of surgical intervention? They grade, there's 4 grades of surgical complications. Number 1 includes minor risks, things that you have to use analgesics, anti-vomit, anti-diarrheal drugs for, etc. Kind of minor stuff following surgery. Grade 2 were defined as potentially life-threatening complications in need of intervention or a hospital stay longer than twice the median stay for that same condition. Were defined as potentially life-threatening. That's grade 2. So what's grade 3? Defined as complications leading to lasting disability or organ resection. Wow. Grade 4 is death. This according to the Annals of Surgery. Surgical complications, more than 40% of surgical complications occur when patients get home. And this Dr. Mark Williams said, a hospital is not exactly the safest place in the world. I wish I could high-five him right now. Most patients would rather sleep in their own beds and not get exposed to the infections in a hospital. These are called nosocomial infections. Look, up on the 7th floor is the burn ward, and you're going to have Pseudomonas bacteria circulating there. All these infections in hospital, viral, fungal, etc. Hospitals are a good place to get the work done you need and then get out as quick as possible. More and more doctors are checking their patients out more timely than they were a few years ago. But Here's my point. If I could have talked to Boney a year ago before she had to have this back surgery, I would have said, Boney, have you tried flexing? Have you tried seeing a good physical therapist and stretching every day? Most importantly, Boney, have you tried some kind of antifungal supplements and diet? Because what makes bread rise can make these tissues in her body begin to rise also, and that hurts. Don't go away, because we've got a great quiz for you as we close today's Know the Cause.
Three of my favorite thyroid support nutrients that you must consider if you want optimum thyroid health. Number one, iodine. If you have low thyroid function, iodine is just like magic. It's almost like caffeine in some ways to the thyroid. Make sure and get tested to make sure you're not hyperthyroid, but make sure to get the iodine in one form or another. Number two, coconut oil surprisingly helps to boost thyroid function, sort of normalize it. And number three, an herb you may have never heard of, but my favorite, Coleus forskolin. We'll have to write that one down. Coleus forskolin. It actually helps to boost the thyroid function and also help the conversion of T3 and T4. These are my three favorites. Give them a try for yourself.
The list of people to thank today. By the way, you guys are right. She does look like a biker with that hat on. Successful surgery, Boney. Thank you for contributing to today's show. You get my point there, right? My point was sometimes surgery changes the rules, okay? So really talk to your doctor about the use of supplements, medications, and so forth after the surgery. Thank you so much, Olivia, for opening today's show and talking with us honestly and openly about a problem you had that was rectified with diet. Why is it that the cancer folks say that whole grains is a good idea if grains are contaminated with mycotoxins? They don't know that yet. Thank you also, Dr. John Trowbridge. Wasn't that fascinating? I mean, here's a doctor that's in the trenches every day seeing a whole lot of patients. He's out in the Houston area, and I know how busy he is, and he's talking about everything he is seeing. Finally today, and thank you, Susie, by the way, for that fabulous information. Finally today, a quiz. Which of the following is a Superman gene and it functions as a tumor and cancer suppressor? P53, BRCA1, CD28 antigen, or the COX2? The answer, of course, because it's a Superman gene, we all have it, is the P53 tumor suppressor gene. The problem is mycotoxins cause it to mutate, okay? Thank you for joining us today. God bless you, folks. I'll see you next time.